Good afternoon, the Honorable Advisor and examiners for the final assignment examination, Mr. Heri Saputra, Mr. Alfian Rosi, Mr. Sujud Priyono. Well, on this occasion, my name is Patrick Fauzi Christian. I'm a student of nursing program at Surya Mitra Husada Kediri. I would like to thank to the examiner and advisor who give the opportunity to present my proposal research with the title The Effect of the Health Education on Reducing Anxiety Level Patient of Pre-Operational ORIF Extremity in Karsa Husada Batu Hospital relate to knowledge of the operational procedure. Background. Anxiety is an emotional state characterized by psychological arousal, an unpleasant feeling of the tension, and feeling of fear that something bad will happen. According to BMC Psychiatry study in 2020, anxiety underwent surgery in the Department of Gynecology and Obstetrics, 28%, orthopedic surgery, 15%, and general surgery, 12%. The rest were operated in 8 other operations. Fracture. Fracture is the break of the continuity of the bone, either due to trauma, pressure, or pathological abnormalities. According to 2018 WHO data, people suffer from fracture due to traffic accident. There were many people who feel they suffered fracture. Fracture management can be done conservative with or operative surgery. With the above background, the research want to conduct research of the effect of health education on reducing anxiety level in patients with preoperative ORIF in the extremity in Karsa Husada Hospital. Research purpose. General purpose to determine the effect of health education on reducing anxiety level in patients with perioperative ORIF extremity in Karsa Husada Hospital relate to ignorance of surgical procedure. Special purpose. Knowing the character of respondent, knowing the patient level of anxiety pre-ORIF extremity, analyzing the patient's level of anxiety pre-ORIF, analyzing the decrease in the patient anxiety level, analyzing the effect of health education on decreased anxiety level of ORIF extremity patient. Benefit of research. This code becomes ingredient of knowledge of nursing Benefit practical to find out the description of the level of anxiety patient to increase the understanding for nursing practitioner of the importance of target education management can meet chart headroom in the monitoring health education. Research of the effect of health education on reducing preoperative anxiety has been done, but so far, to determine the decrease in the level of anxiety in patients with preoperative extremity ORIF associated with ignorance about the operative procedure, not yet. Fracture. Fracture is broken bone which usually caused by traumatic power PC. Close fracture. When no there in connection among fragment bone with world outside. Open fracture. When there is connection among fragment bone with world outside because extended skin. Management fracture. Reduction fracture, return fragment bone on the alignment, rotation anatomical. Immobilization, keep it and return function status neurovascular always monitor. Make wrong one from reduction, immobilization which know it open reduction internal fixation at ORIF. ORIF concept. Something deep operation with installation internal fixation which conduct when fracture nucleus reduced in by enough with close reduction for maintain position which appropriate on fragment fracture. ORIF goals. Repair function with return movement disability, reduction painful, clean to ADL with health minimal, circulation which adequate maintenance of no skin damage. Indication and contradiction ORIF. Fracture that no stable, fracture neck femoral, fracture forearm low distal, and fracture interarticular, fracture avulsi major. Contraindication, bone osteoporosis, network soft on quality bed, there is no infection, existent comminute fracture that critical, patient with drop awareness, patient with fracture that critical and not yet there is an efficacious bone, patient with experience weakness. ORIF advantage. Early mobilization without fixation outside, accuracy reposition fragment fracture, opportunity for check visual, blood, and nerve surround, stability fixation, which enough, adequate, cold active. Care at the hospital short, potential for maintenance function joint, ORIF losses. Every anesthesia and operation have risk complication, handling operative and large possibility infection. User and metal internal allow failure tools, soft tissue damage around the operating area. Anxiety, conditional which vision and experience equal, accompanied with feeling which empowered and determined. State anxiety and trait anxiety. Anxiety level, health education media, form of independent nursing action to help client overcome their health problem through learning activities. Health education, there's a change in attitude and behavior of individual names, special group and communities in fostering and maintaining healthy living behavior and playing an active role in effort to achieve optimal health degrees. Print media, electronic media, board media. Framework conceptual. Need service of health. Intervention nursing. Intervention variable. Level of convenience. Health-seeking behavior. Institutional integrity. Best experience. Best policy. Health-seeking behavior, internal behavior. Visual of death, and external behavior. Research design. Quantitative method pre-experimental. One group pre and post-test design. Instrument depression anxiety stress scale. Framework. Anxiety pre-op patient of extremity. It's a population. For total sampling, sample patient pre-op or extremity with total sampling. Pre-test DAS, health education will be post-test. Data processing, editing, scoring, tabulation, data analysis, bivariate, and conclusion, presentation. Inclusion criteria. Cooperative, age 12 and 18. Willing to be a respondent, first time operation, elective surgery schedule. Exclusion criteria, no children and the elderly, patient with decreased concussion, not a situ operation, patient with complication. Research variable. Independent variable, health education. Dependent variable, or if preoperative patient anxiety related to ignorance about the surgical procedure. Operational definition. Variable independent health education. Definisi operational, the process of health education and health promotion in patient. who experience anxiety related to ignorance about surgical procedure at Karsausada Batu Hospital. Parameter excavation of the form of anxiety, give information repetition based by the patient. Total measuring unit program, SAK leaflet. Dependent variable, worry pre-operation or if extremities relate to ignorance of the operating procedure. Definisi operational, feeling of fear, anxiety, tension that occur in patient undergoing the preoperative phase because they don't know the surgical procedure. Parameter anxiety level, need information about operating procedure, tool measuring the patient anxiety stress scale ordinal. Rating scale 0, 4, 3. All score are to determine the predicate. Data collection. Questionnaire the patient anxiety stress scale. Data collection procedure. Preliminary study. Research permits. Determine respondent according to inclusion criteria. Explain the research procedure to the respondent. Inform consent. Pre-test dash education. Post-test dash data processing. Data processing, editing, coding, scoring, tabulating. Analis data bivariate. Di tes statistik Wilcoxon sign rank test. Research ethic, inform consent, anonymity, confidentiality. Thank you.